Welcome to today's episode, where we're diving into the fascinating world of weight loss strategies, specifically focusing on GLP-1 medications and the roles of carbohydrates in achieving a healthy weight. And just as a reminder, GLP-1 medications include Wegovy, Zepbound, Semaglutide, Tirzepatide, Ozempic, and Mounjaro. Over the past few years, GLP-1 meds have gained significant attention for their ability to help people manage their weight by controlling appetite and improving metabolic function. But that's not all we're exploring today. We're also going to discuss the low carb approach, often hailed as a powerful tool in weight loss, while addressing the important fact that carbs are not the enemy. Yes, while reducing carbs can help shed pounds, they're also essential for fueling your body in the right way. So, how do you strike the balance? Can you combine the benefits of GLP-1 medications with a low carb diet, or is there a middle ground that works best for sustainable weight loss? We'll break it all down, uncovering the science behind these approaches and offering practical tips for making informed decisions about your diet and weight management plan. So grab a cup of coffee, get comfy, and let's jump into today's conversation about GLP-1 meds, low carb living, and how carbs can actually play a positive role in your weight loss journey. Lower carbohydrate diets work well for weight loss when taking GLP-1 receptor agonist medications due to a combination of physiological and behavioral factors. Here's a breakdown of why this approach is effective. It causes a synergistic effect on appetite suppression. GLP-1 medications reduce appetite, delay gastric emptying, and increase satiety, meaning a feeling of fullness. When combined with a lower carb diet, which naturally stabilizes blood sugar levels and reduces insulin spikes, cravings for sugary and starchy foods decrease significantly. GLP-1 meds amplify these effects, making it easier to stick to a low carb eating plan. Patients on these medications tend to prefer smaller, protein and fat based meals over high carb foods due to their reduced appetite. Next is improved insulin sensitivity. GLP-1 medications improve insulin secretion and glucose metabolism. A lower carb diet further reduces blood sugar and insulin spikes, enhancing insulin sensitivity. Lower insulin levels promote fat burning, also known as lipolysis, making it easier to lose weight. Combined, GLP-1 meds and lower carb intake can reduce insulin resistance, which is a common barrier to weight loss. And then there's reduced caloric intake. Both GLP-1 meds and lower carb diets contribute to automatic calorie reduction. GLP-1 meds suppress appetite, causing you to eat smaller portions. Lower carb diets help control hunger hormones like ghrelin and stabilize blood sugar, reducing energy crashes and the desire to snack on high calorie foods. This calorie deficit drives weight loss. And next is metabolic flexibility and fat loss. A low carb diet forces the body to rely more on fat for energy instead of glucose. GLP-1 meds support this process by lowering appetite, which aligns with the metabolic state of ketosis or fat burning. You're more likely to achieve fat loss rather than lean muscle loss, especially if you maintain protein intake. This makes the weight loss more sustainable and healthier. And then there's improved adherence and fewer cravings. GLP-1 meds often cause aversions to highly processed or carbohydrate-rich foods due to slower gastric emptying and the way they affect the brain's reward pathways. This makes it easier to, number one, stick to a lower carb diet, which naturally emphasizes whole foods, proteins, and healthy fats, and also makes it easier to, number two, avoid triggers like sugars and refined carbs, which are major culprits in weight gain. And next is glycemic control. For people with prediabetes or diabetes, combining GLP-1 meds with a lower carb diet provides excellent blood sugar control. Stable blood sugar reduces fat storage, hunger, and energy crashes, creating an optimal environment for weight loss. So, The combination of GLP-1 medications and a lower carb diet creates a powerful weight loss synergy by reducing appetite and cravings, stabilizing blood sugar and insulin levels, promoting fat burning over glucose resilience, and supporting adherence to a healthy lower calorie eating plan. This makes weight loss more efficient and sustainable while also improving overall metabolic health. Now, let's move on. What exactly is considered a lower carb diet? A lower carbohydrate diet focuses on reducing the intake of foods high in carbohydrates like bread, pasta, rice, and sugar, while emphasizing proteins, healthy fats, and non starchy vegetables. As already stated, this approach helps stabilize blood sugar, reduce insulin spikes, and promote fat burning, which are key for weight loss, especially when paired with GLP-1 medications. A lower carb diet typically involves limiting carbohydrate intake to around 50 to 125 grams of carbohydrates per day, depending on individual goals, lifestyles, and metabolic needs. For comparison, the average person eats about 225 to 325 grams of carbohydrates daily. Now, to clarify further, here's a breakdown of carb intake. I consider a moderate low carb diet consists of a carb range between 100 to 150 grams per day. This is suitable for individuals looking to reduce carbs gradually without strict restrictions. Someone in this range can include moderate portions of whole grains, fruits, and starchy vegetables. Now, with a lower carb diet, which is what I prefer, a person can aim for a carb range in between 50 to 100 grams per day. The focus is on minimizing sugars and refined carbs while allowing portions of whole complex carbs like quinoa, oats, or sweet potatoes. This is ideal for sustainable weight loss and improved blood sugar control. And then next is the very low carb, which is more keto like. An individual in this range can aim for 20 to 50 grams per day. Their carbs mainly would come from non starchy vegetables like leafy greens, broccoli, and zucchini. This approach can lead to ketosis, where the body burns fat for fuel instead of carbs. And then there are people who do what I call a true keto diet, where they do not eat more than 20 grams of carbs per day. I have been there and done that, and honestly, it was not for me. But now, let's talk about what else you should eat while lowering your carbs. So here's a simple breakdown. Of course, you should be eating your protein: meat, poultry, fish, eggs, tofu, and protein shakes. And then healthy fats: avocados, olive oil, nuts, seeds, and fatty fish like salmon. And then your non starchy vegetables, which are low in carbs. This would be things like your leafy greens, broccoli, cauliflower, zucchini, asparagus, cucumbers, and peppers, which I tend to eat a lot of. Now, your carb sources in moderation should be small portions of berries, sweet potatoes, quinoa, and oats. Next, let's discuss foods to limit or avoid. So, sugary foods and drinks. Of course, candy, sodas, pastries, and fruit juices. And then refined grains: white bread, pasta, rice, cereals, and crackers. And then starchy foods: potatoes, corn, and processed snacks. And high sugar fruits. This would be things like bananas, grapes, mangoes, and pineapples. You should consume them sparingly. And keep in mind, you don't have to avoid them, but you should limit them. I actually do eat white rice, and I actually eat potatoes. and bananas. However, I eat them sparingly. And for me, they are timed according to my workouts. And if I need something that's going to give me that burst of energy or whatever the case may be from those particular high sugary or off limit carbs. So now I will give you a simple example of a lower carb day. And this is a lot of what I actually do eat. Breakfast: scrambled egg whites with spinach and avocado. Lunch: grilled chicken with a large green salad, olive oil dressing, and some nuts. Snack: string cheese or a handful of almonds. Dinner: salmon with roasted broccoli and cauliflower rice. And that's just a simple example. I actually eat 5 to 6 times a day, but this is for someone who's eating 4 times a day. And most of the time, people who are on GLP-1 medications are not eating 4 times a day, maybe three, sometimes twice. But I do highly recommend you snack throughout the day as tolerated. And of course, snack on healthy snacks. I am not a fan of eating a keto diet because it is not sustainable for many. However, a lower carb diet in the range of 50 to 100 can work well for most, and it can be sustainable. A lower carb diet doesn't mean you eliminate all carbs forever. Instead, it encourages mindful choices focusing on nutrient dense, whole foods while reducing sugar and refined grains. This flexibility makes it easier to stick with long term, especially supported by GLP-1 medications that reduce appetite and cravings. Now, the reason I am not an advocate of a keto diet is because the keto diet, short for ketogenic diet, is a very low carbohydrate, as discussed. Generally, it promotes high fat and moderate protein eating plan. Its goal is to push the body into a metabolic state called ketosis, where the body primarily burns fat for energy instead of glucose derived from carbohydrates. While I am not personally a fan of it, I have never discouraged a patient from continuing a keto diet if they were already on it prior to coming to see me for treatment. Now, let's discuss what happens when you stop the keto diet, which is a huge reason why I'm not a fan of it, but there are other reasons. When you reintroduce carbohydrates after following the keto diet, several changes occur in your body: glycogen and water replenishment. Carbs are stored in your body as glycogen in muscles and the liver. For every gram of glycogen stored, the body retains 3 to 4 grams of water. As you eat more carbs, your body quickly replenishes glycogen stores, and you may notice water weight gain within the first few days. This happened to me a few years ago. I was basically on a keto diet, eating 20 grams or less of carbohydrates per day. I was in prep, preparing for a bodybuilding show. The night after my show, and for the next 2 days, I ate carbs like crazy because I was not used to eating them due to being on a keto diet for several months. I remember I gained 12 pounds of water weight from Friday to Monday. That was just 2.5 days. I was distraught, but I knew it came from the carbs. Perhaps that is why I'm not fond of keto diets, but it's more than that, as I previously stated. Honestly, to me, it's just not the healthiest way to lose weight and to treat your body. I want you to eat in a way that is sustainable. Now, let's move on to other things that can occur when you discontinue a keto diet besides the water weight gain. Your blood sugar and insulin levels can increase. Carbs cause a rise in blood sugar, which triggers insulin production. Insulin helps store glucose as glycogen or fat. If you abruptly reintroduce too many carbs, you might feel energy crashes from blood sugar spikes and dips, as well as hunger cravings, as higher insulin can stimulate an appetite. Next, fat burning slows down. When you stop keto and eat carbs, the body shifts back to using glucose as its main energy source. Fat burning decreases, and if you overeat carbs, you might regain fat. Then there's digestive discomfort. The keto diet limits high fiber foods like grains, beans, and fruits, So your gut might need time to adjust to higher carbs and fiber rich foods. This can cause bloating, gas, or irregular bowel movements at first. Then there's potential weight regain. As I stated, many people lose water weight and fat on keto. But if they return to eating high carb and high calorie foods without moderation, weight gain can occur quickly. This is why transitioning off keto should be done gradually and with balanced, nutrient dense meals. This is easier said than done and must be strategically planned. And then increased appetite and cravings. The appetite suppressing effects of ketosis disappears when you add carbs back. Sugar and refined carbs may trigger intense cravings, making it harder to control portion sizes. However, it's important to remember that carbs aren't inherently bad. They do have a place in your weight loss journey. The key is moderation. Avoid extreme approaches like cutting out carbs entirely or, on the other end, overloading on them. For most people, a lower carb approach tends to be the most effective. I hope you enjoyed today's episode. I'm Dr. Andrea Walker, family nurse practitioner and owner of Dr. Andrea's Medical and Weight Loss Clinic located in Memphis, Tennessee, as well as Telehealth DNP LLC, where I treat patients online in Arizona and Florida. To book a free consultation for my eFit Transformation Program, call 305-970-1970. The eFit Transformation Program consists of monthly online training and individualized meal plans. The cost is $200 a month. Be trained by an IFBB professional bodybuilder, GLP-1 expert, and weight loss specialist. Make sure you get your workouts in this week. Don't forget to meal prep and get your water in. Until next week, bye for now.